Hello everyone and welcome to our module on antiviral medications. Unlike the large number of antibiotics used to treat bacterial infections, there are only a small number of antiviral drugs that are used in modern clinical practice, so we'll go through all of these in this module. There are two drugs that are used to treat influenza infections. Ribavirin is sometimes used for RSV and hepatitis C. Acyclovir is a very commonly used medication to treat herpes infections. There are three drugs that are used to treat cytomegalovirus infections, and finally we'll talk about the uses of interferon in viral infections. Zanamivir and oseltamivir are two drugs used to treat influenza infections. You may know the drug oseltamivir by its other name, which is Tamiflu, and these drugs inhibit the enzyme neuraminidase, which is unique to the influenza virus. So recall that the neuraminidase enzyme is very important for helping the virus leave infected cells. This enzyme cleaves sialic acid from glycoproteins on the surface of the virus, and if sialic acid is not cleaved from the glycoproteins, then the virus can't get out of the cell. This is a required step for exit from infected cells. These drugs have only been studied and shown to be efficacious in the first 48 hours of illness, so they're not useful if someone's had the flu for 5 days, and they don't really have any important side effects that you need to know about. Zanamivir is an inhaled medication, oseltamivir is oral, and for that reason, Tamiflu is the one that's most commonly used today. So the next set of antiviral medications are drugs that interfere with DNA or RNA synthesis, and this is a very effective way to suppress viral replication because, as you know, one of the main jobs of the virus is to copy its DNA or RNA. So if you inhibit that, then the virus can't multiply. But before we can talk about the drugs, we need to review some general principles of DNA and RNA, and let's start by looking at this molecule on the screen here. So this is a DNA molecule, and DNA is made up of repeating units called nucleotides. So a nucleotide is a ribose sugar, like what I'm circling right now, attached to a base, and then it's also attached to a phosphate group which links it to another nucleotide. So these nucleotides are strung together to make a chain of DNA or RNA. So in this case we have a DNA molecule, and the base up here is adenine, and when adenine is attached, we call this whole structure right here the nucleotide adenosine. And then over here we have a thymine base attached, so that makes this whole nucleotide thymidine. And down at the bottom we have examples of the bases guanine and cytosine. And as you know, in RNA there is no thymine base that is used, but instead uracil is used. Shown on the screen are the chemical structures of the 5 nucleotides used to synthesize DNA and RNA. I've shown them all in their triphosphate form. So note that each nucleotide has a ribose sugar, a base that is attached, and then 3 phosphate groups. The way that DNA and RNA polymerase work is they pick up these nucleotide building blocks in their triphosphate form, and then the enzyme splits off 2 of the phosphate groups and leaves 1 phosphate group attached and uses it to form the backbone that we saw on the last slide. The way that many antiviral drugs work is they mimic the structure of one of the nucleotides shown on the screen here. For example, many antiviral drugs mimic the nucleotide guanosine. What happens is the virus picks up the drug thinking that it is guanosine, but instead it's a drug. It then incorporates the drug into a growing strand of DNA or RNA, and once the drug is incorporated, the chain can no longer grow, and thus we say that the chain has terminated. So here's a summary slide just to make this point very clear. Many antiviral drugs mimic the nucleotides. We'll talk about all these drugs in the next few slides, but they all work through this similar mechanism. The drug gets used by DNA or RNA by mistake. It wants to use a nucleotide, but instead it uses the drug which looks like a nucleotide. And once the drug is incorporated into the growing DNA or RNA chain, the chain terminates. So they're described as inhibitors of RNA or DNA polymerase, but it's important that you understand the mechanism by which they inhibit the enzyme. These drugs often have to become triphosphorylated. Remember what I said on the last slide, that these nucleotides have to be triphosphorylated to get incorporated into DNA or RNA, and the drugs are the same way. They must also be triphosphorylated. The enzymes that phosphorylate them are called kinases. A kinase is an enzyme that adds a phosphate group. And sometimes the virus has its own kinase, and sometimes the cellular kinase of the infected cell is used. But one way or another, the drug gets triphosphorylated. And an important common mechanism of resistance to these drugs is a mutation of the viral kinase. So it mutates so that it no longer recognizes the drug, and then the drug is no longer effective. So let's start by talking about ribavirin, and first let's look at its chemical structure. At the bottom left side of the screen here you can see the chemical structure of ribavirin. And note that it's very similar to the nucleotide guanosine. What's different is this base attached to the ribose molecule. It has a different structure than the base attached to guanosine. As a result, when RNA polymerase binds this, thinking it's binding a guanosine, it is going to become inhibited and not be able to keep working and keep synthesizing RNA for the virus. So ribavirin has to get triphosphorylated to be incorporated into RNA, and there are cellular kinase enzymes that do this, so enzymes in the infected cell that will do this. Once ribavirin has 3 phosphates attached here, it can then bind RNA polymerase, and this prevents binding of the correct nucleotides, and as a result, you see a drop in viral replication and you see production of defective virions. Ribavirin also inhibits an enzyme called IMP dehydrogenase, and IMP stands for inosine monophosphate. And this is the chemical structure of IMP down here on the bottom right side of the screen. And you can see that it's very similar to ribavirin. IMP is a biochemical intermediate that gets converted by cells into guanosine nucleotides. So when IMP dehydrogenase, which is one of the enzymes that converts IMP into guanosine, when IMP dehydrogenase binds ribavirin, thinking it's an IMP molecule, it then becomes inhibited. This is going to decrease the pool of available guanine nucleotides, so there'll be less guanosine around to use in general, and this means less around for viruses to use to build copies of their nucleic acid genomes. Ribavirin has 2 main modern uses. The first is RSV infection in children. Now this is somewhat controversial because clinical trials have not shown a clear benefit, so it's generally not used routinely, but it's reserved for children who are very sick or immunocompromised. And then ribavirin can be added to interferon for the treatment of hepatitis C infection. Key side effect is hemolytic anemia, so this drug likes to accumulate inside of red blood cells, and the concentration inside red blood cells can get very, very high. So when the concentration is high and the drug gets phosphorylated, it depletes the phosphate pool, and as a result, the red blood cells have a relative ATP deficiency. This results in hemolytic anemia, which can occur in about 10% of patients, and it can be very severe. And this is a big problem when trying to treat patients with ribavirin for chronic hepatitis C. It's also highly teratogenic, so it can't be given to pregnant women. The next drug is a cyclovir, and this is an inhibitor of the herpes virus DNA polymerase. So herpes virus can synthesize its own DNA polymerase, and this drug will inhibit that enzyme. And the way it does this is by mimicking the nucleotide guanosine. So this is the chemical structure of deoxyguanosine right here. And at the bottom is the chemical structure of a cyclovir, and you can see that they're very similar. They both have a similar base here, but what's missing from a cyclovir is the ribose sugar. It just has an oxygen here. So once the viral DNA polymerase binds this acyclovir molecule, it's not going to be able to add any additional nucleotides to make DNA polymers, and therefore it's going to terminate the chain growth. A unique feature of acyclovir is the way it gets phosphorylated so that it can be taken up by DNA polymerase. The first phosphate group gets added by a herpes virus thymidine kinase. This is a wonderful feature of this drug because it means it will only have efficacy in infected cells. It won't get triphosphorylated and used by DNA polymerase in any cells unless they're infected with the herpes virus. Once the herpes virus kinase acts on it, it becomes a cyclovir monophosphate, and then the monophosphate form gets triphosphorylated by cellular enzymes. So the infected cell has enzymes which add 2 more phosphate groups to acyclovir so that it will be triphosphorylated. And then, as I said before, it acts as an analog to guanosine, so it will look like deoxyguanosine triphosphate and mistakenly be taken up by DNA polymerase, and then the enzyme will become inhibited. The way that viruses develop resistance to this medication is by decreasing the amount of thymidine kinase that the virus produces, because that first step won't happen if there's less of this enzyme around. Also, they alter their viral thymidine kinase so that they won't phosphorylate this drug. And finally, sometimes the virus will create altered DNA polymerase molecules that don't bind acyclovir. There are a couple of similar drugs in the acyclovir family. One's called famciclovir, which has a similar mechanism but has a longer half-life, so you can use a lower dose. And there's another drug called valacyclovir, which is a prodrug. It gets converted to acyclovir in the body, and it has greater bioavailability, so a lower dose can be used. And valacyclovir has become the favored drug in many viral infections. All 3 drugs are generally well tolerated. The only important side effect to know about is that if you give acyclovir in its IV form, it can cause nephrotoxicity because it crystallizes in the urine, and for this reason it's often given with IV fluids to try and reduce the risk of this complication. Acyclovir is effective for herpes simplex 1 and 2 infections, and also varicella zoster infections like shingles. Now you may recall that Epstein-Barr virus and cytomegalovirus are also herpes viruses, but this drug is not very effective in those infections because they have a different viral kinase that's not as effective at phosphorylating this drug. These drugs can be used in genital herpes, herpes labialis, herpes encephalitis, herpes zoster, and sometimes they're given for suppressive therapy. Recall that all 3 of these viruses can lay dormant in nerves and then reactivate, so people who have frequent reinfections of genital herpes or oral herpes will take one of these drugs for suppressive therapy so that they don't get those flare-ups of the infection. The next three drugs we're going to discuss are used to treat cytomegalovirus infections. So cytomegalovirus infections are a big problem in HIV/AIDS, and they're also a big problem in transplant patients, especially patients who have received a solid organ transplant, for example, a kidney, and they're on chronic immunosuppressive drugs. There are three key drugs to know for treatment of cytomegalovirus infections. These are ganciclovir, foscarnet, and also cidofovir. And as we'll see, all three of these drugs target the cytomegalovirus DNA polymerase. The virus makes its own DNA polymerase, and these drugs will work to inhibit that enzyme. So ganciclovir has a very similar mechanism to acyclovir, and that's easy to remember because the names sound alike. They end in ovir. Ganciclovir is an analog to the nucleotide guanosine. It gets intracellularly converted by a cytomegalovirus kinase to become the monophosphate form, ganciclovir 5' monophosphate. And then the remaining two phosphates get added by cellular enzymes, so they take it from the monophosphate form to the triphosphate form. Once it's triphosphorylated, it mimics deoxyguanosine triphosphate. It gets incorporated into DNA and terminates chain growth. The main toxicity of ganciclovir is bone marrow suppression, especially low white counts and leukopenia. The reason for this is because although the drug targets the viral DNA polymerase, it also inhibits some bone marrow DNA polymerase. So if you know the mechanism, it's easy to remember this side effect of the drug. There is a cousin of ganciclovir called valganciclovir. It's a prodrug that gets converted in the body to ganciclovir, and this has better bioavailability. Ganciclovir is primarily given IV because it's got such poor bioavailability when you give it orally. Oral valganciclovir is now the preferred drug for a lot of cytomegalovirus infections because it's got oral dosing and therefore it's much easier to administer. The next CMV drug is foscarnet, and this drug is a pyrophosphate analog. And what I mean by that is that it mimics the structure of a phosphate group. So this is foscarnet down here, and you can see that it's got this phosphate group right here. And what's going to happen is that DNA polymerase will think it's one of these phosphate groups right here, and it will bind to foscarnet, and once it binds, it can't do its job and cleave the phosphate groups off of nucleotides. So it binds and inhibits viral DNA polymerase and blocks cleavage of pyrophosphate groups from triphosphates and nucleotides, and this stops the DNA chain elongation. Foscarnet is used in cytomegalovirus infections when ganciclovir fails. It's also used in some acyclovir-resistant strains of herpes and varicella. The main and limiting side effect is nephrotoxicity. In addition to causing kidney failure, it can chelate calcium, which can lead to hypocalcemia. It makes the kidneys waste magnesium, so the magnesium level can get low, so electrolyte monitoring is very important in patients on this drug. And it has been shown to cause seizures, and this is sometimes related to the very low level of electrolytes. The last CMV drug is called cidofovir. This drug is a nucleotide analog to cytidine, and that's easy to remember because there's a C in its name. You can also remember the C for cytomegalovirus. This drug is phosphorylated by cellular enzymes, so it does not require a viral kinase. And once it's phosphorylated, it inhibits DNA polymerase. And you can see down here at the bottom, this is the structure of cytidine, and over here is the structure of cidofovir, and they look relatively similar, but cidofovir is missing the ribose sugar, and therefore once it gets incorporated, the chain can't continue to grow. The main use of cidofovir is in CMV retinitis, which is a very serious eye infection, and the main toxicity is renal failure. There is an anion transporter in the proximal tubule that binds this drug and results in high concentrations of it in the renal cortex, and that can lead to renal failure. You can reduce the risk of this complication by co-administering the drug with saline to flush the kidneys, and you can also use a gout drug called probenecid, which blocks renal tubular secretion of the drug. Now this might seem strange. You're blocking secretion of the drug into the urine, and you're making side effects less likely. But what appears to happen is that probenecid blocks the accumulation of this drug in tubular cells, and this makes it less likely to cause renal failure. The last antiviral therapy I'll mention very briefly are the interferons. As you know from immunology, these are cytokines. They're glycoproteins synthesized by infected cells and also by lymphocytes. And there are many, many ways by which interferons modulate the immune system and the body's ability to mount an immune response against infection. Interferon alpha primes cells to fight against viruses, so it's been given to patients with hepatitis B and C, and it's shown to decrease viral replication. Kaposi sarcoma is a skin lesion that patients get when they have HIV/AIDS. It's caused by the virus HHV8, and interferon alpha has also been shown to be effective in treating this condition. And that concludes our module on antiviral medications.